Welcome to Medroad Map, a knowledge channel by myMedroads.com where healthcare meets clarity. We help patients make informed healthcare decisions across the borders without noise, pressure, or hidden agenda. We believe that better healthcare decisions start with better information. In this podcast series, we speak with hospital leaders, doctors, and healthcare experts to understand the evolving trend in the global healthcare landscape, about patients traveling cross border for their treatment requirements. And hopefully, this information that we share here will really help the patients who are trying to travel cross border for their needs. Our guest today is Mr. Rahul Shukla, the head of International Patient Services at Aster Dubai. Rahul, a very warm welcome to you.
Thank you, Sri, first of all, for having me, for this podcast. To begin with, about myself, as you said, I look after International Patient Services Department at Aster Healthcare Dubai. We are a large format healthcare organization. Since 1987, we started our journey from a small clinic to where we are today. Multiple hospitals across brands, across different formats, from primary healthcare to secondary, tertiary, and quaternary care healthcare. Aster Healthcare at large is present across 7 countries in the GCC, not just in Dubai. And we try and see to it that the patients, when they are juggling from their home market to another country, our role is to help them, handhold them through the entire process so that there's no anxiety in their heads when they're choosing a particular hospital in any of the destinations, including Dubai, Oman, Qatar. And that's where we try and treat our international patients primarily. Looking forward to the conversation today.
Thank you, Rahul. That's a wonderful introduction for yourself. And yes, when a patient is requiring treatment and which is critical, I think what most important comes to him or her is how I can really, get to the right information and right decision making. Let's dive into the core topics. We have seen since 2020 with COVID coming, the global healthcare landscape has been evolving. So, what sort of patients are really traveling to Aster? If you see since 2020, has there been a change in the pattern, profile, or how is it?
So, if you primarily talk about Aster as a company, we have got two service offerings for international patients. How we have categorized it as gene therapy division and non-gene therapy division. So we have got patients coming to us specifically for gene therapies for neuromuscular disorder, which is a pioneering novel therapy that Aster Healthcare as a group started back in 2020. And this program has been running for over 5 years, where we see patients coming in from different parts of the world, for seeking gene therapies for neuromuscular disorders, specifically for spinal muscular atrophy and Duchenne muscular dystrophy. And that's what comes under the umbrella of gene therapy division. And then we have got non-gene therapy division, which looks after all the multi-speciality treatment that we offer from our hospitals from Dubai, Oman, and Qatar. So, primarily non-gene therapy entails the entire multidisciplinary care, including oncology, orthopedic, neurosciences, and so on and so forth. So these are the two category of patients that we treat at the moment. They would come from anywhere from our neighboring markets, which is the GCC and the larger Middle East, including Oman, Saudi Arabia, Kuwait, Qatar, into Dubai. At the same time, a lot of movement happens between Africa, East and West Africa, and we are looking at how can we also attract a bit of North Africa and Central Africa at the moment. Apart from that, we also see a lot of traffic coming into our hospitals from Russian-speaking region and Eastern European region, and of course, a small amount of them, they do also come from Southeast Asia, including Bangladesh, Sri Lanka, Maldives, and India. So you'll be surprised that even India is where we receive some of our patients from. And gene therapy division, we do have a scope of service, which is, as I said, it's a novel therapy. It is not available in each market, and that's where we receive, some of the patients coming in from India to our hospitals.
Interesting. Do you see the profiles of the patients coming are belonging to a particular segment of the economic society?
A very good question, in fact. So if you look at the two categories that I explained, one being gene therapy and the other being non-gene therapy, I must say that gene therapy is a service that is not available in larger medical tourism destinations, so to say, right? It's regulated by different governments in different countries. These patients, when they come to us for gene therapy, they could be anybody who have found means to get the treatment done. The cost of gene therapies are exorbitant at the moment because these are all the new therapies which are coming into the market. So they could be parents who would go for charities, who could go for crowdfunding, and who could look for the government support, because as I said, the price of this gene therapy is very very high as compared to any other treatment that we would see, the regular treatments. So that's on the gene therapy side. The non-gene therapy side, the kind of people who would come to our hospitals in Dubai would be somebody who would demand the certainty of care, who would who would want to come to a particular destination or a hospital where they get clarity of who they are going to get treated from, what are the kind of pricing structure, where they are going, and have they been able to establish contact with that particular hospital and the treating physician. So I think the kind of clients that we see coming in for our multidisciplinary care is the client that do not want any hassle when they arrive or through their so kind of patients who are coming to us now more and more are the patients who were otherwise traveling to UK or Europe or to US for that matter, as they find it difficult to access to visas. Those are the people who are trying to choose us because of ease of logistics, clarity, regulated healthcare environment.
Yeah, good. Maybe when a person traveling from London or Lagos or from anywhere in the world choosing Dubai, Aster here specifically, also I'm sure the quality, right? Would you like to share something about it?
So you see, largely if you look at the need for medical tourism, I think it is different for different people. I would categorize the need for medical tourism in these four buckets. One could be affordability, the other could be the quality of care at home, the third would be the waiting period, and fourth would be privacy. So the need for a person traveling from Africa to a destination like UAE would be to get the quality of care at the right price, which otherwise they wouldn't get the same thing at the same price in the US or in the UK. So people, when they look at Dubai as an option from UK, it would be primarily because of the long waiting list. When they look at the Russian speaking market or Russia itself, it could be because of the visa restrictions that they face in the current scenario. And that's why, since they have got an open visa system here in Dubai for Russians, they would look at Dubai as an option. So essentially, what I feel is that the need for different destination or for different nationalities to come to Dubai for treatment would be different. But yes, of course, quality of care, is
That's
like
non-negotiable.
non
And
negotiable.
I think that's not a question when we speak of Aster Dubai, right? The quality, the
Absolutely.
services, the accessibility of technology to enable the right standard of services and the right quality of treatment, I'm sure is quite great in Aster, right? When we speak about medical treatments these days, lot of terminologies and jargons are available, like robotic surgery and like AI diagnostics and remote health monitoring. All this comes into play. So I'm sure that patients also get quite confused, listening to all this jargons in the in the market, and then the social media hype, right? There's so much of digital marketing happening, and that is also loaded with phishing. Every information is not the right information or the quality information. So being at your vantage point of leading the international patient services of Aster Dubai, how do we see is we can help patients discovering the right set of hospitals, right set of medical facilities, and right set of doctors to get there, and then develop the trust also, because this is very very sensitive area when it comes to treatment. So how can we help them, you think?
So at Aster, since we have multiple hospitals across brands, as I said, so Aster DM Healthcare operates Aster branded hospitals and Medcare brands of hospitals across Dubai, Sharjah, Oman, and Qatar. where we treat our international patients primarily. So what we have done is we first have tried to centralize the international patient services operations, so that we are able to create a uniformity of the dialogue that we have with our external sources, the governments, the insurance companies, the patients themselves, right? We have tried to create a center of excellence model. So I'll just give you an example. In case if a patient is looking for a cardiac surgery, we know that there is a hospital at Aster, which is a center of excellence for cardiac sciences. And that's where we do a larger number of complex cardiac surgeries for which we receive patients for from simple cardiac procedures to complex redo procedures as well. So there's no doubt that in case if an international patient inquiry would land, we would first refer that inquiry to that particular hospital, which is a center of excellence for cardiac sciences. So that the patient is looked after by the team which is capable of handling the complex most cases that that they could be, and they are completely done up with the entire infrastructure that would require to treat the patient, and and then the outcomes are the best. In case if it is somebody coming in for neurosciences, we know that there is a team of neurosurgeons which are available in one of our Medcare hospitals. If it is for orthopedic and spine, we have got a entire hospital itself called Medcare Orthopedic and Spine Hospital, looking after all kind of orthopedic and complex spine cases, including pediatric orthopedic and spine cases. So this kind of central unit helps to bridge the gap, bridge the contact between or communication between the patient and that particular team of physicians at a particular hospital, without sending it to everybody. We know that the patient is coming for the kind of care that would be available in that particular hospital or under that team of doctors would be the best. So we do not want to then confuse ourselves or the patients by giving them multiple options of different hospitals that we have, as I said, across multiple geographies. So that is how we try and communicate with our patients individually, very much personalized, trying to connect with the patient and give them that proper information and guidance before they have come to us, by connecting them to the doctor so that they could talk to the doctor and they could discuss in case if they would like to bring in their own local treating physician to the call. That's very much possible. And then once they have spoken, I think our work becomes easier, because then the patient has literally spoken to the doctor while sitting at their home country, and then deciding whether they would like to come to a particular hospital or not.
So all the prep work can happen before the individual lands onto the country, right? Depending on the requirement, you help them to connect to the right specializations and the right specialty doctors, and they can have the remote conversations. And that is where, once they feel comfortable, they can arrange for the travel readiness and whatsoever it is, and then land into Dubai and have the treatments.
In
And
fact,
I'm
I would
sure.
go a step further, Sri, on this. So it is not just at the time when we are trying to acquire a patient to our hospital, but it continues when the patient has come to our hospital and goes back after getting the treatment to their destination, where our team of doctors are equally accessible for any kind of follow-up that may be required. I must give you an example here of our gene therapy division. So we have got few of our markets from where we receive our gene therapy patients in large numbers. I would name some of them like Russia, Turkey, some of the CIS markets. So there we have got connects with the local physicians, where our doctors at the time when they are referring back the doctors for a follow-up care is connected for a lifetime. In case if patient would like to get in touch with us or through their local doctors with us, that window of communication is always open. So this does not just help us while acquiring a patient, but at the same time looking after the patients after they've gone back, because many of these treatment is not just one-time treatment. So some of these treatments goes for maybe 5 years, 10 years, or maybe lifelong. Creating this kind of entire cycle of the communication from the local doctors while receiving a patient and while referring back the patient once the treatment is done. This dialogue is very important, and for few of the specialties and in few of the markets, we've been able to successfully do that.
So that's the acquiring phase you help, but also once one phase of the treatment is complete, it's a handover, right? The patient goes back to their home country, but you are telling that that is also when the patient can stay connected to the same set of doctors, either directly or through their local physicians. I think that is where It's treating a human, not just as a medical tourist, somebody coming and binding up and going. I think that definitely gives a lot of assurance to the patient, whomsoever is listening this podcast as a patient, or maybe a relative of a patient who is really seeking healthcare across the globe beyond their home countries. I think this is very, very helpful.
And as I said, you see, connecting with the local physicians really, is very important because the patient might not be able to come back and forth to Dubai for, follow-up care, right? So what happens is when there is a clinician to clinician connect, they talk the same language and they know how to follow up a patient locally, right? So there is no need for a patient to keep coming back here all the way to Dubai just for a follow-up care.
When it comes to patients and treatments, there are certain treatments which is more elective treatments, and there are certain which are more specialized treatments. When I was looking at the data points, I see that from African countries, there have been a 31% growth in arrivals from Africa to Dubai when it considers medical tourism. And for CIS, it is around 99% growth over recent years, which is a huge growth. It is also maybe a reason that the local hometowns of these individuals are not necessarily equipped with all the advanced treatments or maybe elective treatments they are seeking for. They maybe are sitting at the economically that juncture where they can afford to travel and get the best of the treatments. So, how do you see this, kind of distributed?
Maybe if I can say that it is not just on the destinations from these patients from where these patients are coming, but at the same time it is also to do with Dubai as or UAE as a medical tourism destination, right? If you compare UAE to other destinations like Singapore, Thailand, India, or UK, Germany, we would still, be much younger when it comes to offering medical tourism as a services to the world, right? So there's a lot of work that has happened in the last 10 years in Dubai, where government has played a role in communicating the medical services that Dubai has to offer or UAE has to offer to the world. At the same time, private healthcare providers have also joined the bandwagon by going into different territories, communicating with different stakeholders, and then positioning Dubai as or UAE as one of the choices of destinations that patients can look for, and that really got catapulted after COVID. Right during COVID, if you see, most of the destinations were closed, for medical treatment. But I think Dubai was one such destination open most of the time, and when there was no choice for people to to choose from, I think Dubai came as an obvious place where people started coming in, and then they realized that it is such a wonderful option. There are wonderful hospitals, the right set of doctors, at the same time the regulatory body, which plays a very active role in not just regulating the licenses, the accreditations, etc. At the same time, regulates also how we can actively communicate with the different key markets, the source markets, and promote our services. All of that put together has put Dubai and UAE at large as a destination where more and more people are looking at as an option for treatment. Africa, yes, is a historical destination from where a larger amount of medical treatment is happening because of the lack of treatment. If you talk about African patients, they could choose from India, Thailand, UAE, and now Turkey as an option, right? There are multiple destinations that has come into play now, and there are multiple choices that are available for people. But if I can talk about Dubai, what Dubai is offering today is the safety, the certainty, ease of access, the logistics, and the world class hospital and hospitality at the right price point, I would say. And that's why it is becoming a destination not just from Africa or larger Middle East, but also from Eastern Europe and larger Europe, where people are coming here to seek treatment.
They're coming for elective treatments and non-elective treatments.
Absolutely, yeah. In some countries, it is unique to only elective procedures because of the long waiting list, right? In some countries where it is because of the lack of standard treatment or because of the high cost, it is for both elective and non-elective procedures. With elective procedures, the best part is that you could plan it very well. If you seek healthcare abroad, the electives can be planned at your right time and the dates as of your liking, as again something which is serious, which needs to be immediately catered to.
Coming down to the realities, what are the different concerns you see when a patient tries to decide on certain treatment outside their home country? If I can help nail down two, three concerns and how we are addressing them, that can help, the more potential patients to have a look at it in advance before the travel.
One of the things that patients look for is the kind of profile of the doctor and the patient and the hospital. So that is definitely something that is in the mind of the patient. And so I think what they should look for is the kind of history that particular hospital has, that in that particular department. Right, as I was mentioning about cardiac sciences program of ours, it has gone from strength to strength for over multiple years. It has got one of the best track records of the lowest possible mortality that there could be in terms of cardiac surgeries. Uh, when somebody is looking for cardiac surgery, I think these are the data points that one should look for: the kind of mortality that the hospital has, the number of years of experience that the doctor has, the availability of the entirety of care from non-invasive, invasive to surgical cardiac sciences. So completing the kind of services that they might need when they travel. Apart from that, at the same time, is the kind of length of stay for a particular procedure, right? The kind of infection levels in a particular procedure, the kind of ICU stay that a patient might need, the kind of how long the patient would be intubated and how earliest they would be extubated. I think these kind of questions, in case if there is an informed patient who wants to know about their treatment, they should be asking these questions from the clinicians if they have an opportunity to talk to them, and they must ask those questions directly head on, without shying away that a hospital or doctor might not respond to such questions. Because I think our work gets half done in case if we have been able to convince them before they travel about the kind of treatment option that we are providing, the kind of expertise that the doctor has, and the cost range that we are providing it for. So in case if we have been able to convince the patient, half of at least our work is done already. We are not leaving anything to chance in their minds. So they are only coming here for that interaction with the doctor and getting the surgery or a treatment done, rather than coming here and then still being confused about whether this is the right hospital or doctor or the price to choose.
One question there, that what differentiates a trusted medical tourism partner from the rest? So, like us, right? We are a medical tourism partner. How we can bring more transparency that you are seeing in the world, it is happening. So, if you have some thoughts about it.
So, for an organization like us, we do work with multiple referral sources who bring in these leads or patients to our hospitals and clinics. Their role is very significant in this entire journey, and we do work with some of the renowned brands who have got the entire system in place of handholding the patients and supporting them throughout the journey, and not just acquiring them as another patient or just for having them sent to a particular hospital or doctor, but looking after them from the time they start having a dialogue about virtual consultations, visa process, flights, accommodations, surgical progress while they are in a hospital, looking after their follow-up care. And that's very important for medical tourism providers also to create the kind of image in mind of patients, because these patients are the ones who are going to be talking about the kind of services they receive, not just from hospital but also from the medical tourism facilitator involved. So it is that loop that gets created. In case if we work with the right set of medical tourism partner, we are sure of the kind of commitments that they would make to the patients, and once that gets fulfilled, both hospital and the medical tourism providers are to gain from the kind of feedback that they would give to the local friends, families, about their experiences.
So, end to end package experience, I think that's what we look for, right? Otherwise, just connecting to the doctor, just because it brings a lot of ancillary things like the travel. like a stay. And when we've also realized when a patient comes to another country, between the treatments, maybe they have to stay 2 weeks in a hotel. Maybe they can experience something. If it's not a very serious treatment, they would love to a little bit explore the city or
Very much.
anything for that matter. Or they may reach out for a Ayurvedic treatment or a meditation treatment in between. So I think it should be the end-to-end experience a patient would look for during the travel. Or maybe there can be possibility of serious patients who would look for more support when they are outside the hospital.
You just rightly mentioned, I missed that point, that often we see that medical tourism providers have gone out of their, call of duty in helping and supporting them while they are in a particular destination for surgery or for treatment. I think taking them around, making sure that they are not just physically fit, but also giving them that kind of emotional support that in case if there's anything that was to happen, untoward incidents, they are there to support them. Because as a hospital, sometimes we have our own limitations. While the patients gets access to the hospital, we can do everything that we can do within our system. But once they leave, or once they are recuperating, or once they're staying back in a country for any other reasons, that's where we have a limitation of scope of service that we can provide to the patient. That's where a trusted medical tourism provider comes very handy in giving that entire support while the treatment journey.
It's been very nice speaking to you, Rahul. We really covered a broad spectrum of information, and as I say, any patients or any individual proximate to a patient listening to this conversation, I'm sure would be helping them and benefiting them.
Talking on various subjects that you just brought up. More often at our work, we sometimes do not realize the kind of importance of each of these aspects. So I hope it helps patients to choose better.
Absolutely. And that's the intent, making more and more information and right information available to the patient so that they can cut through the noise, get access to the right information in a short turnaround, and access to the right treatments in the right way with the right facilities. I hope this podcast brings that visibility and that transparency of information to the individuals. Thank you again, Rahul, for this
Thank you, Lakshmi,
conversation
and thank you, Medroads,
covering.
for having me for this podcast.
Thank you so much. Till we meet again, and anybody would like to reach us, visit our website. It's www.mymedroads.com. Bye bye.